Hi, this is Rebecca French
Hi.
from Aspect of Medicine. How are you?
Yes. Hi, Rebecca French. Welcome back to the program. We are glad that you are with us. You are with San Juan Health Partners, the COVID to Home program, and we're so glad that you are with us to give us an update on how things are going, right?
Yes, yeah. So,
Tell us a little bit, remind us a bit about that program, right? This is with San Juan Regional Medical Center for COVID patients who have been discharged from the hospital and are now recovering from home, correct?
yeah, so our COVID to Home program kind of has a couple of different ways for us to monitor patients. So the first way for us to monitor is basically the patients go to urgent care or the ER, a New Mexico Department of Health, to get tested for COVID if they are having symptoms. We do have a team that's set up to contact these patients with their test results, and then they are offered the option of enrolling into our program to be monitored. And then the providers within the program do basically stratify them into different groups, low, moderate, or high risk patients. And we have a protocol we follow in order to contact that patient. Contact with the patient can vary from just a simple nurse visit contact every couple of days to make sure symptoms are getting better, up to the high risk patients where we're calling them every single day with a provider telemed visit and setting our eyes on them, as well as a follow-up call with the nurse. Now, this is actually, we've had this program now since pretty much the beginning of COVID. We were able to develop it. And so we have been able to send quite a few patients to the hospital prior to any really emergency or deterioration that they might have. And so we're able to pick up on some subtle changes that we noticed where the patients might not, and get them to the hospital in enough time for them to get help.
Yeah, that's really good. And that was kind of my follow-up question, which is, has catching it earlier in that sense, do you think it's lowered the ICU rates?
You know, we don't have a lot of information. COVID, I feel, is a beast of its own. So we don't really study that. We just, our goal is to get the patients to the hospital before there's any, we don't want them to expire at home, or we want it not to be an emergency where they're having to get transported by EMS for a rapid intubation. So I feel like we have been able to help the hospital system that way by eliminating some of these patients and from it being an emergency to getting them into the hospital where they have that support. So, you know, our intervention there may help them from actually needing intubation by getting oxygenation or oxygen at a sooner time. And then they're also able to get remdesivir and dexamethasone before it's an emergency as well.
Understood. And Rebecca French, talk to me a little bit about some of these maybe symptoms, these lingering symptoms, because we always hear about the recoveries of these COVID patients and we celebrate each and every one of them. But we also hear that for some of these folks who have come down with COVID, while some may recover with maybe no ill effects, others have lingering health issues. And can you talk a little bit about the types of things that you're seeing in these patients?
Yeah, definitely. So, you know, I think that's something that we need to start talking a lot more about is what's being called long COVID or post-COVID. And there's now more studies that are being conducted for it. Things that we are seeing that the initial COVID infection, yes, it can be scary, but a lot of these long COVID symptoms are definitely very scary to see as well. So there are a lot of what we have seen is patients having heart attacks, strokes. We've seen these chronic headaches that just won't go away. We can't get control of them. There's been neurological changes, memory loss, memory fog. Dizziness is a lot of symptoms that we see. Hair loss, extensive hair loss. We've had patients that have actually shaved their heads because they've had so much hair loss. We have, lung problems, chronic cough. Some patients are having significant damage to their lungs that's requiring to now be on oxygen. There's, a disorder called pulmonary fibrosis that's being seen. So they're not very mild symptoms that are long short-term symptoms that patients get, some of them are actually very severe and will probably be lifelong, unfortunately. So, again, it's not a normal cold where you get sick and then you recover. It's more severe than that.
Sure. And I would like to know if there are any contributing factors as to why some people are the long haulers compared to the recovered and then sort of back closer to normal baseline. Is that something that we've been able to draw correlations to?
No, I haven't seen anything on that. This is, we're evolving as it goes. So this is now like a new topic that's starting to be studied. So I haven't seen a lot of research studies or anything that can explain that again. And we don't know who's going to end up with these or not. We do know that if the more severe COVID symptoms a patient does have, it seems like those patients are the ones that end up with the long COVID symptoms. But again, we can't determine who's going to have those severe symptoms and who's not.
Right. And so I guess, if you were to come down with COVID-19, that's really a gamble as to how severe your case may be, right? Because you could have it a mild case and the person sitting next to you, 6 feet apart, would maybe have a not so mild case, right? I mean, we just don't know, do we? And I mean, we know there are underlying health conditions that can certainly exacerbate some of these things, but it's really is a gamble, isn't it, to knowing maybe how severe your particular case is going to be?
Yes, exactly. So we do have, high risk categories and everything based on their health, their previous health. But we've seen very healthy individuals that have no comorbidities whatsoever end up on ventilators for months at a time and end up with severe symptoms afterwards. So, there's no rhyme or reason. We just haven't been able to figure out who's that higher risk category and who's not.
Right. That makes a lot of sense. And I hope that we all take that as a caution. There's still some nonchalance out there about practicing COVID-safe practices, and we realize everybody is getting exhausted by this process. But I think it's really important to shine a light on all of these, pretty scary and severe lasting effects.
Well, and as the doctors will say, I'm sorry to interrupt you, Megan, but the doctors will say the virus isn't getting tired of this, and that's the problem.
Of course not.
So
it's just finding a host.
Stay.
That's all it does.
Yeah. No.
So, and Rebecca, one last question, because last time we talked to you, which was a long time ago, actually, this thing has dragged on, we discussed COVID toes, which was horrifying to me. Are the COVID toes still a thing? Not that all these other things are horrifying as well, but that was weird, I thought.
Yeah, I mean, it's still out there. Like, patients are still getting, it's something that we watch for. I don't know how many people do end up getting it. Again, I think it's more the severe cases that can end up with those, but there's just so many different side effects that, or symptoms that we're seeing where something new will come along and we're just learning as we go. But I do, feel that, I know that there's this COVID fatigue going on throughout the entire community and United States and across the world, but we really need to just try to continue with all of the recommendations, wearing your mask, everything that we've been talking about over and over again, because this is going to help us to prevent the spread. Our numbers in New Mexico are going up, and it is pretty scary to see, just because there's going to be, I hope not, but there could be a situation where we basically run out of beds at the hospital. And I have been noticing that our patients that we're getting in our COVID program discharged from the hospital are sicker because they're not able to stay in the hospital for that longer period of time, simply because, there's more demand or we're short-staffed in the hospital, or, not short-staffed, but, our nurses are going through a lot of stress too. So we have to kind of consider all of that in this whole thing, and, the psychological aspect as well.
Understood. Well, and I think that your folks at the hospital are trying to keep some beds available for those other patients that are coming, and they don't know how severe those are going to be, and so they're trying to move them into your program maybe a little bit faster than they would like to if they had more capacity. Is that maybe a good answer?
Yeah, I mean, our beds, of course, are not we're not at that stage yet,
I
and
see.
hopefully we never will be. But the hospital is doing everything they can. We have our incident command center that is preparing for every possible situation that we can think of. So we are, the hospital's doing a great job in preparation, in coming up with plans and stuff to accommodate for an influx of patients that could potentially happen. So yeah, I feel like we're all working pretty well together to provide the community, healthcare and support, not just for COVID, but for even your other chronic illnesses that do pop up, because there are other things out there besides COVID as well.
That's very true. Well, Rebecca French, we appreciate your time this morning and coming back to talk with us on the program and the program that you are working with, for all of these patients who are being discharged from the hospital but still requiring some medical care, and that's what the COVID to Home program is doing. So thank you very much for joining us.
Yep, thank you.